Hi, this is Dr. Sarada Vani, the obstetrician and the gynecologist. Today, let's answer all your Google questions. The first question that is popped up is, does fertility vary from one woman to the other and why? There are many factors that influence the fertility. The age is the first most factor that will influence the fertility. Younger women have high fertility rates. As on your age passing on, crossing 30, 35 and 40, your fertility levels gradually decline. This is the most important factor. So the next comes the menstrual cycles. The woman who is regulating, where the woman is having the regular menstrual cycles, her fertility levels are very good, and these are influenced by the many other factors like the hormonal factors, the PCOD especially, where the eggs are not released on time. So the age is more important factor. Then the next comes the menstrual cycle. The woman should have the regular menstrual cycle. The next comes is the woman is having any pelvic infections, especially when untreated pelvic infections will lead to infertility. Okay, then comes the uterine factors. Having an abnormal uterine cavity sometimes lead to infertility. Then multiple fibroids or any kind of submucosal fibroids or the polyps inside the uterine cavity also lead to infertility. Sometimes the women even of the younger women, because of the pelvic infections, there will be a blocked fallopian tubes. These also lead to infertility. Now comes the egg quality, and the number drops with the age. So ultimately it all comes to the age, which is important. Younger women will have good fertility. As on your age increases, your fertility levels will decline. Last but not the least, the lifestyle is more important to maintain your fertility. The next question is, do eggs retire at 35 years? That 35 years, this is a most important age for the fertility. At 35 years of age, definitely the number of eggs are reduced and also the quality of the eggs is equally compromised. So better plan your pregnancy between as early as 30, if not never delayed, between 30 to 35 is appropriately advised. The next question is, are we born with fixed number of eggs? Yes, definitely we are born with fixed number of eggs. The number of eggs for a woman are determined by the genetics of the woman, and it is actually predetermined in the genetics. When the woman is born, she will have about 1 to 2 millions of eggs. As on the age of the woman, once she reaches her puberty, she will have around 3 lakh eggs, and as on she passes her every menstrual cycle, the total number of eggs definitely decline, and once she reaches 35, and the number of eggs definitely are almost 20,000 or 25,000, and once she crosses 40 and 45, she will be having at least a minimum as 1,000 eggs. The next comes, how do I know I am fertile female? This question can be answered in many ways, but medically there are two things you can observe whether you are fertile woman or not. Women having a regular menstrual period, the regular cycle, if she is calculating her cycle, say suppose if she is having her periods of about 28 days, then at 14 days of her period, she can observe the changes in the cervical mucus, which usually the cervical mucus can be seen as a sticky and a clear discharge from the vagina. And also for some women, there at 14th day, she can notice some stain of blood. These two signs will definitely help her to know whether her ovulation is at 14th day, or if not on 15th day, if her periods are between 28 and 29 and 30th day. The next question is, how can I improve the quality of my eggs after 35 years? So as women more of this generation are planning at around 35 years, how to improve? So this question mainly depends on how the lifestyle modifications are made. What is her lifestyle? Is she eating well? Is she sleeping well? The stress has to be managed properly. Good exercise, good amount of fruits, good amount of nuts, good amount of water intake, and more importantly maintaining her BMI. And last, no smoking, no drinking is one important suggestion I say for the women who are planning for pregnancy at the age of 35. There is one more question. Is freezing eggs the only option? Definitely this is a question to be answered, especially women if they are not planning pregnancy, or they are not, the couples who are not having an idea to plan a pregnancy at least by 35 and 40, then definitely the freezing is the only option to have their genetic child. Wearing tight jeans, fertility boosts or fertility bust? This is actually, wearing tight jeans is actually not anything related with fertility, but wearing tight jeans, in fact it will reduces the blood circulations in the pelvic area, it will increase the sweat in and around that area, and it will increase the risk of urinary tract infections, and it will increase the risk of fungal infections. This in turn may affect at some point or indirectly related to the pelvic infections. So it may affect your fertility. The next question is, can 3 cups of coffee keep your eggs awake or just your energy? I say it is only keeps you awake your energy, not your eggs. Coffee is never ever related to the fertility at all, and it is only limited cup of coffee doesn't affect your fertility at any time, and it is not written in any research, or nor there is any study that is going to affect your fertility. And thank you. I think I must have guided you well.